Imagine sitting at the doctor's office for a normal checkup. You feel great, but something's not right. The nurse takes your blood pressure and has a concerned look on her face. But a high blood pressure is no big deal, right? According to the CDC, nearly half of all adults in the United States are diagnosed with hypertension. It was also mentioned that only 1 of 4 of these adults actually have it under control. In a variety of articles over hypertension, the CDC said, in 2018, nearly 500,000 deaths in the United States included hypertension as a primary or contributing cause. I don't know about you, but to me, that seems like way too many deaths for something that can be prevented or managed better. But how will we do this? I'm going to teach you what hypertension is, what it can lead to, and how it can be prevented or managed. First, we are going to discuss what hypertension, also known as the silent killer, is. To further understand this, we need to know what blood pressure is. Blood pressure is the pressure or force of blood moving through the arteries of your heart. Blood pressure is broken into a systolic over a diastolic number. Systolic pressure is the pressure of blood when the heart beats, and diastolic pressure is the pressure in the arteries when the heart is at rest. A blood pressure is considered to be hypertensive or too high when the systolic pressure is over 120 and the diastolic is over 80. You also don't want hypotension or too low of a blood pressure, but that's a conversation for another time. You might be asking yourself why a high blood pressure is bad. This is because the harder our heart works to pump blood out to the rest of our body, the more damage it can cause to our heart and other vital organs due to the lack of oxygen. So, what are some causes of hypertension? There are non-modifiable risk factors for hypertension or causes we cannot change. Some of these include your age, being over 65, family history, ethnicity, specifically African Americans, and gender, males. You can also have other health conditions that can cause hypertension, such as diabetes. Lastly, there are modifiable risk factors, or risk factors that we can change for hypertension. Some of these include obesity, smoking, excessive alcohol intake, inactivity, stress, and an unhealthy diet. All of these things mentioned can cause hypertension, but hypertension itself can cause many severe disorders if not managed properly. Some of these conditions hypertension can cause include heart disease, heart attacks, and strokes. While all of this can seem terrifying, the good news is there are so many preventative measures that can be taken. One thing that commonly raises a blood pressure is stress. Preventing stressful situations or using self-relaxation techniques, such as deep breathing, can lower blood pressure significantly. The main thing we can do to prevent hypertension is maintaining a healthier lifestyle. We can do this by limiting our salt intake in our diet, exercising for approximately 30 minutes 5 times a week, smoking cessation, limiting our alcohol intake, and maintaining weight or losing weight if obese. However, if you manage to get diagnosed with hypertension, there are steps you can take to protect yourself. One way we manage hypertension is by treating our other health conditions. For example, if you have diabetes, make sure you regularly check your blood sugar and you're taking your insulin. We can also manage hypertension with medications, which is extremely common today. A common medication you will see used to treat hypertension is metoprolol, which is classified as a beta blocker. Other drug classifications for managing hypertension include ACE inhibitors, calcium channel blockers, vasodilators, and diuretics. If you are on medication, it is extremely important to adhere to your medication regimen and to monitor your blood pressure at home with a blood pressure cuff. In conclusion, we have discussed exactly what hypertension is, what it is caused by, long-term effects, how to prevent hypertension, and how to manage it. While this seems like a lot of information to take in, it is definitely worth teaching about due to how common and deadly this condition is. Hypertension is nothing to take lightly. With a variety of simple steps, we can lower the number of deaths in the United States related to hypertension. In return, we can learn how to protect ourselves and our loved ones. I hope everything you learned today is put to good use. Will you take the extra precautions to protect your health? Or will you be one of 2 adults in the United States unfortunate enough to be diagnosed with hypertension?